We've heard a lot lately about larger hospitals in major cities being ready to treat any Ebola patient who comes in. And our Aaron Cargall even took a tour of UMC Brackenridge a few weeks ago and showed you an isolation unit, even the suits doctors would wear. So are local hospitals ready to fight the virus? Here to give us a little insight is Dr. Todd Bagwell. He's an infectious disease expert with Seton, which has 10 hospitals in 7 central Texas counties. Now, are smaller and rural hospitals ready for this?
Yes. Yeah, there's a plan in place to evaluate those types of patients and immediately arrange for a transfer to a referral hospital in the city.
So what would the procedure be exactly if somebody were to walk in with the symptoms?
You have to identify these patients quickly, and unfortunately it's going to be a pretty rare situation, but it would include travel to an area or close contact with someone who was with the disease. They would be identified and immediately isolated and gowned up, and then arrangements would be made to transfer them immediately.
Is it hard to diagnose Ebola? Let's say you don't know that somebody did travel to West Africa or was in contact with somebody, because the symptoms seem to be kind of similar to a lot of other illnesses. Yeah,
it is very nonspecific early on, and it's going to be difficult. And the whole key there is that travel history. That is key to understanding what's going on with that individual patient. So but usually that's not hard to get from either a family member or the patient himself or herself.
And when you were talking about moving somebody to a bigger hospital, is that just because they have the resources that the smaller hospitals might not have?
Yes. I mean, we call them tertiary referral centers, and all the, like Smithville, Highland Lakes, some of the surrounding areas are pretty small and don't have the resources to handle something like this, and they would refer into either Brackenridge, like you mentioned, or Seton Medical Center, or St. David's is also prepared as well.
And for people like myself who are not in the medical field, you all are actively training for infectious diseases just like this and other things that we might not even know about right now.
Absolutely, yeah. This is part of what we do, and we're educated about it. We read about it all the time. We go to meetings. We hear about it, and it's a big coordinated effort. It's actually one of the biggest things I've seen the CDC do in a long time. I think it's been very good. They've received some criticism, but I think that's a little unfair. I think they're doing a good job, and I feel very comfortable with where we're going.
All right.
What we're doing. Yeah.
Well, thank you so much, Dr. Bagwell, for your time. We really appreciate you joining us here on our Saturday.